everyone, my name is Michaela and I'm a registered nurse who works in the critical care unit at a level 2 trauma center, and today I'd like to inform you about the verticalization bed. So, have you ever wondered how a healthcare worker can get a bedbound patient who is unable to get up out of bed on their own to a standing position without using almost any effort? It's hard to comprehend that that's a possibility, but it is, and it is something that I have seen and utilized with the help of the verticalization bed. So I'd first like to go over what the bed is. The verticalization bed is a specialty piece of equipment that gradually takes a patient from a supine or horizontal position to an almost upright standing position with almost no effort, and the patient is safely strapped in so they do not go the other way. This allows the patient to feel the physiological effects of standing without using almost any of their own strength to do so. And a company that makes this is Craig Therapeutics, and they state that they can hold patients up to 750 pounds to that supine to vertical position. So it is a very technological piece of equipment, and you may wonder how it was introduced to healthcare. Well, the beds have been evolving for decades. Hospital beds change every year, and there's new things added to them as medicine changes. So this bed is just a stepping stone for that. So who knows what will be in the future, but within the last few years, there's been a lot of studies on early mobilization in healthcare, and these beds allow healthcare professionals to utilize that. So in the early 2000s, there was a few studies done in the intensive care units that showed that patients with increasing oxygen demands who need some support breathing were able to sit in a standing position with the use of a verticalization bed, and the healthcare workers wanted to know if standing caused them to breathe better than if they were lying down in bed, because your lungs are able to get better expansion when you're standing rather than laying down. So there was only a few studies done back then about the beds, but in the last 5 years there's been a lot more hospitals utilizing these beds, and I will discuss that in the next few points. But they're really used for varying patient needs, and I would like to talk to you now about who may use those beds. So an example could be a patient on mechanical ventilation, which is a breathing tube that helps them breathe, and they're also usually on many medications that cause them to be sleepy. These are called sedative medications. And when they're on these two things, it makes it very hard for the patient to do any effort and use their own strength to get out of bed, because mobility is also an important part of recovery. So since they're on these medications and this breathing support, they need a little extra help to get the therapies they need to help recover. And the verticalization bed allows for that, because it will take the patient to that standing position and allow them to participate in therapies when they wouldn't usually be able to do that. So the bed is doing almost all the labor, and this helps the patient feel the physiological effects of getting up and moving around, whereas the nurses and the physical therapists don't really have to use any effort as well, because the bed is doing it all, almost all of it really. So that's just one example of a patient who may qualify to use these beds, but it really can be used for any patient who has been in the bed and unable to use their own strength for many days to weeks. So I've just personally seen the patients in the ICU setting, but I know it could be used for many other situations as well. So you may wonder how many hospitals are utilizing these beds, and it's not an exact number because it's more and more every day. It may be a few beds that are rented for a whole hospital, and they just use it as they see fit, or the entire unit has them and they just use them on patients as needed. But some studies show that out of the top 10 hospitals, over 350,000 use the verticalization beds. So that's 350,000 patients that may benefit from the use of these beds just in the top 10 hospitals. That that doesn't even show like all the hospitals in the US that have a percentage of those beds. So every day it's changing, and more hospitals are adopting these beds. But in conclusion, the verticalization bed is a tool used in healthcare to assist patients with many different physiological needs. And I discussed the patients in the critical care unit, but it can be used for patients who are bedbound as well. And today I went over the functions of the bed and what it is and how it works, as well as how it was introduced to healthcare and how many hospitals are implementing the beds into their practice. And I really hope I gave you a clear understanding of what these beds are, and how they're used in the hospital setting.